Did you pledge New Year, New You? Well, if diet and exercise aren't doing the trick, you might need a new approach. And here to share the secret to successful weight loss, welcome the founder and CEO of Hotze Health and Wellness Center, Dr. Stephen Hotze. Dr. Hotze, we know that there are times people walk in and say, I am eating right, I am exercising, but the weight's not coming off. And we're sitting there looking at them like, sure you are. Well, a lot of times people are doing the so-called right thing, but something else is working against them in their body.
Well, oftentimes when people try to lose weight, they'll lose 10 or 15 pounds and hit a plateau, and they don't seem to lose anymore. That's because the body recalibrates itself or readjusts itself to the new weight. What you really have to do is get your metabolism up. And people that have a problem and a difficulty losing weight, it's usually because their metabolism is sluggish and slow.
And that's what helps us burn energy.
Remember, your metabolism is the production of energy in your body, and that relates directly to your hormones, specifically to the thyroid hormones, which come from the thyroid gland in the neck. And those thyroid hormones, as they're released into the blood, don't do anything in the blood. No matter how much thyroid you have in the blood, it's got to get into the cells, and in the cells, and the thyroid enables the cells to produce and use energy. So one of the reasons we see a problem with weight gain, 67% of Americans are overweight, half of those are obese. 34% of the population is obese. That's not healthy for you, because when you're obese, you have a dramatically increased risk of what? Adult onset diabetes or type 2
Which
diabetes.
means heart disease, renal failure,
That's
all those
you
things,
get heart
blindness.
disease, high blood pressure, increased risk of cancer, degenerative arthritis, Alzheimer's disease. All these problems occur with weight gain. So we want to get our weight down. We know this from actuarial statistics. This is life insurance statistics. People that are thin live longer than people that are overweight. That's a statistical
Because
average.
although the body needs fat, when you have too much fat, what types of things happen? What does that do?
It just puts you in an increased risk category to develop all these other diseases. And the fact that you have increased fat in your body tells you that you're storing toxins, because this fat is where toxins are stored. So toxins from things we breathe, eat, drink, and slather on our bodies, these petrochemical toxins from insecticides and the various chemical additives in the foods and in the drink. All that has to be, the body tries to rid it, but the liver gets overwhelmed, so it stores it in the fat. The fat cells carry toxins. The toxins leach out. They cause inflammation in the body.
So that's the domino effect where you get sick.
And that's what causes all the diseases. That's why people that are overweight tend to have these host of diseases that we've talked about, the diabetes and the heart disease and the cancers and the high blood pressure.
At Hotze Health and Wellness, one of the things that you all do is you just do a comprehensive view of what somebody's dealing with, and you first of all listen to the patient, and then that gives you the clues of what could be wrong. Sometimes it is the hormones. We'll talk a little bit more about that in a second. Other times what gets in the way are food allergies that we're unaware of. You actually do food allergy testing.
We do. As a matter of fact, a person can be allergic to any number of foods. Normally, we think of food allergy, people think, well, a peanut allergy, and they get anaphylaxis, or a shellfish allergy like shrimp, and they get an anaphylactic reaction. People can be allergic to common foods. Wheat, corn, egg, milk, yeast, or soybean are the big six, because they're in all the various foods. And if a person has an allergic diathesis, in other words, a predisposition towards allergy, by eating the same food over and over again, they can react to it. It can cause nasal congestion, sinus congestion, asthma, bronchitis. It can cause headaches, migraines,
because what's
eczema.
Healthy for some people might not be healthy for others.
The old adage, one man's meat may be another man's poison. And that goes the same for women, too.
Yeah. So going back to hormones, other ways of knowing that you may have an imbalance, besides having the weight gain, which, because of you mentioned the thyroid slows down the metabolism, fatigue, headaches, depression, all those things. So once you realize you have a hormonal imbalance, how do you fix it?
Well, if we have a hormonal imbalance or a hormonal decline, we're not getting enough hormones into our cells, we replenish those. Now, we check blood levels on on several of the various hormones, but we don't base our treatment strictly on the blood level. We base it first upon the symptoms. And so if you have symptoms of fatigue or difficulty with weight or cold sensitivities or headaches or insomnia or joint muscle aches and pains or stomach disorders, hair falling out, recurrent and chronic infections.
There's a medicine for all those.
Well, there's medicine that can treat the symptoms, but we want to get at the underlying cause. And so what we want to do is we want to replenish the hormones that are declining, and we want to make sure they're balanced. Particularly in women, you want to balance the estrogen with progesterone. In males, you want to replenish with testosterone. All these hormones affect the thyroid gland and the production and utilization of thyroid hormone.
And again, that metabolism, because we hear also...
And that governs your metabolism.
We also hear about estrogen dominance. What does that mean, and how does that impact our weight?
As women march through their menstrual life, their progesterone levels, the hormone of the second half of the month, in a 28-day cycle, you make estrogen hormones all month long. Half of the month, if you ovulate, you'll make progesterone. Those are to balance each other. As women mature, they have anovulatory cycles where they don't always ovulate. They make no progesterone, so estrogen becomes the dominant hormone. It's a proliferative hormone.
And we see it in that tummy area, that tummy fat.
Gain weight, but it causes increased production of the inner lining of the womb, so we get heavier periods, irregular periods, breakthrough bleeding, breast enlargement, fibrocystic breast disease, recurrent headaches, premenstrual syndrome. All those are a sign of estrogen dominance, which can be easily corrected by adding a little progesterone, natural progesterone.
And that way, if you eat right and exercise, then it pays off. All right, so we said a lot of terms here. I know some of them can be confusing to folks, but you're having the True Fat Loss Summit, where people will be able to understand this better and be able to understand different ways that they can actually finally get that weight off and keep it off.
Well, we're going to be talking about toxins and their adverse effect and how they cause weight gain. Good eating program, hormones, we're going to be discussing that. And we're going to be showing some new ways that, with some new procedures that can be done to help really get rid of fat.
All right.
Knock it out and dissolve it.
And when you said that, you looked right at me. So
no,
thank you very much.
No.
Thank you, Dr. Hotze.
Thank you.
And Dr. Hotze has written 2 books about hormones and hypothyroidism. Visit hotzehwc.com/GDH to get your free copies today. All you have to pay is shipping. And everyone in today's studio audience is going home with a copy of Hypothyroidism, Health, and Happiness. Once again, you can join Dr. Hotze this Saturday for a weight loss symposium. Also joining him, celebrity guest speaker Danny Calhill, winner of The Biggest Loser, and nutrition expert Dr. Arlen Hill, as well as vendors with healthy products and food. They also have this new machine, the latest that melts fat. To register, visit hotzehwc.com. And for more information on Hotze Health and Wellness Center and to make an appointment, call 888-473-5531, 888-473-5531.